Good afternoon, everyone. This is a lecture on Chapter 8, the skeletal system, specifically the upper appendicular skeleton. I'm going to move through these slides pretty quickly, so I'd recommend following this lecture at least twice today. As you recall, the skeleton is made up of the axial skeleton, shown in blue, comprised of 80 bones, primarily centrally located, and the appendicular skeleton, which is 126 bones. And you remember the word appendicular kind of sounds like appendages. So the appendicular skeleton means the upper and lower limbs, so your arms and legs. And the appendicular skeleton also includes two girdles, the shoulder girdle and the pelvic girdle that will attach to the axial skeleton. So we'll begin discussing the upper appendicular skeleton by talking about the shoulder girdle. The shoulder girdle is actually called the pectoral girdle. And of course we have two of them, left pectoral girdle and right pectoral girdle. And each girdle is made up of two bones, the clavicle, which you may know as your collarbone, and the scapula, or the shoulder blade. Our clavicle, or collarbone, is one of the two bones in the pectoral girdle, and this is an S-shaped curved bone. It has a medial and a lateral end. The medial end will articulate with the sternum or breastbone, and the lateral end articulates with the acromion of the scapula. So in these photos below, the top view will be an S to I view of the clavicle. So we're looking down onto it in the first picture on the top. Your reading right side will be the medial or sternal end. And you're going to remember that because the medial end on your reading right is a very flat. It's going to attach to the sternum or breastbone. And then when you look at the lateral end or the acromial end of the clavicle on your reading left, it's very rounded and curved, so you can distinctly tell the difference between these two bones, or two ends of this bone, whether it's in the S to I view on top, or the image below is an I to S view looking down underneath the clavicle. The sternal and acromial ends will always look the same. The second bone that makes up the pectoral girdle is the scapula, or shoulder blade. The scapula is a flat bone that's located in the superior posterior thorax, specifically between ribs number 2 through 7. The scapula will connect to the humerus, which is the bone of the upper arm, through a joint space called the glenoid cavity. Now I have 3 pictures for you of a scapula on this screen. On your inferior reading left is the posterior view, the lateral view, and the anterior view. Let's start with the posterior view though. The scapula has several borders and angles. So if I'm looking on your lower reading left at the posterior view of the scapula, my reading left side will be my medial side. So this side of the scapula with the blue line is called the medial border. The medial border will be closest to the spine. The orange line on the same view is the lateral border. Up top in gray, we have the superior border, and the tippy top of that superior border is called the superior angle of the scapula. Just below the superior border, you notice we have this large flattened area, which we'll call the supraspinatus fossa of the scapula in purple. We also have a very large projection on the posterior scapula view, and that large projection in green is called the scapular spine. At the end of the scapular spine in light blue on the most lateral tip is called the acromion process. Now from the posterior view, the acromion process looks somewhat small, but if you look to your lower reading right on the lateral view, you can see that the acromion process is actually a very large hook. This acromion process is what's going to actually wrap up and around the shoulder to connect with the clavicle on the front side to create the pectoral girdle. On both the posterior and lateral views in the red circle, we have the coracoid process of the scapula, not to be confused with coronoid process of the mandible. This is coracoid process of the scapula. Now, when you look at the posterior view, you can see that it kind of looks like it's sticking up in between the superior angle and the acromion process. But when you look over to that lateral view, you can actually see that the coracoid process is a little bit more anteriorly facing. When you look at the bone in different views, it looks differently based on the angle that you're seeing it. And also worth noting on that lateral view, you can also see the glenoid cavity right in the center, and that's where the ball of the humerus, which is the upper arm bone, will fit perfectly into that socket. Going up though to our anterior view, all the way on your upper reading right, what we've done now is actually we've flipped that scapula bone. Instead of looking at it back to front, we're going to look at it front to back. So pretend like the entire rib cage that will sit in front of it has just been peeled away. So on the underside of that scapula, we also have another large fossa, which is in the dark red circle that we call the subscapular fossa of the scapula. And the word subscapular literally means under the scapula. The blue and orange lines I've drawn in for you again to match the lower diagram so that you remember which side is medial and which side is lateral. You're always going to know the lateral side because it will have the acromion process, the coracoid process, and the glenoid cavity. So the lateral border, which is drawn on the orange line, is usually quite easy to identify. I also drew in the scapular border in gray up top. Now, if I follow the scapular border down, closer toward the direction of the coracoid process and the glenoid cavity, you see in light green that there's this little notch. It looks like a little hook in between the superior angle and the coracoid process in red. That little green notch is called the scapular notch. You can also see it on the posterior view. I've also marked in light blue the acromion process so you can see it from an A to P view. And those are our main surface markings of the scapula. Moving down the upper limb from the scapula, we'll have the humerus, which is the upper arm bone. And the humerus articulates with the scapula proximally. So that rounded head of the humerus will fit perfectly into the glenoid cavity to create a joint. Distal to the humerus, we have the radius and ulna. Radius and ulna are the two bones of the forearm, which also connect perfectly. The humerus also has several surface markings to note. Now on this screen, I'm actually looking at two right humeruses, but I'm looking at them in two different directions. So on your reading left, that's actually a right humerus, but I'm looking at it A to P. And I know that for two reasons. First, when I look at the scapula, I can see the very large subscapular fossa. So I know I'm looking at it front to back. When I look at a humerus, I want to notice at the distal end of the humerus, in blue, this bow tie looking structure. The bow tie looking structure will be at the anterior part of our elbow, and if you look at the other view, they look distinctly different. So whenever I look at a bone, the first thing I want to know is what bone is this and how am I looking at it? So I find that subscapular fossa on the scapula, and then I see on the humerus that we have that large bow tie structure at the distal end. So I know that my reading left view is actually a right humerus, and I'm looking at it A to P. So let's begin on that view. And I actually want to start at the distal end, the end of the humerus that will make up the anterior elbow. First, I identify in blue that bow tie shaped structure right in the center. The bow tie shaped structure is actually made of two structures, a capitulum on the lateral outside and a trochlea on the inside. So capitulum and trochlea make up that bow tie. Just superior to the bow tie, we have two little divots, which are in purple and pale blue. Now, when you see this bone in lab live, it looks perfectly like two little divots. You could actually just put your two fingers right in it. On the lateral aspect, we have the radial fossa, and medially, the coronoid fossa. You'll remember that the radial fossa is always to the lateral side because in the forearm, the radius is always the lateral bone. So that makes perfect sense. Just exterior to the radial fossa and coronoid fossa, in red and green, we have epicondyles. So these epicondyles kind of describe these lateral rounded projections at the distal end of the humerus. You'll notice between the lateral and medial epicondyle that the medial epicondyle is much larger of a projection. So that's just one more way that you can always identify what you're looking at and how you're looking at it on a humerus. If we move superiorly on the humerus, we have the body or shaft of the humerus, which is a core part of every single long bone that we look at. On the shaft of the humerus, we also have anteriorly kind of a roughened projection called the deltoid tuberosity. Now, why would one call this the deltoid tuberosity? Well, of course, because as you'll learn in the next unit, the deltoid muscle will attach right here on the shaft of the humerus. At the proximal end of the humerus, I'd like to use your right anterior view first to mention the greater and lesser tubercles, which are in black and purple circles. So remember, a tubercle is just a small rounded projection. We have a lesser and a greater. From this view, it actually appears as though the greater tubercle is smaller. And you don't really want to remember these based on their size. You want to remember them based on their location. So the greater tubercle is the most lateral. So if you felt on the outside of your arm and you felt down from the acromion process, that outside part that you'd feel would be the greater tubercle. In between the greater tubercle and the lesser tubercle, we will have a groove that you could run your finger along, and we'll call that the intertubercular groove, or the intertubercular sulcus would also work. Now switch over to your reading right for a moment, and let's take a look at that posterior view of the right humerus and scapula. Most long bones will have a shaft, and then they will also have a neck. But the humerus has two necks. The first neck is in yellow, highlighting, and this would be the anatomical neck. So this is the part where it kind of looks like you could actually just break the cap off the top of the humerus. It's called the anatomical neck because of its development. So if you remember back to our bone lecture, we talked about the concept of the epiphysis on the end of a bone, and the epiphyseal growth plate. So when the bone is growing, it leaves that growth plate, which is a line that almost looks like it could have been a fracture, but it's not, it's normal. And that helps create the anatomical neck of the humerus. However, in orange highlighting, we also have a surgical neck of the humerus. And it's called a surgical neck because this is a common fracture site of a humerus. So 2 different neck structures on the humerus for you to remember. Now our humerus makes up our upper arm, and in the forearm we have 2 bones, the radius and ulna. You'll always know which one is the radius when they're together because it will always be on the lateral or thumb side. So remember what I showed you in class. If you think about giving someone a thumbs up and you're going to say, "That's rad," it reminds you that radius is always the thumb side. Now on this diagram, I'm looking at a picture of 2 forearms. Your reading left is an anterior view, and I know that because when I look at the anterior elbow, I see that bow tie structure, that capitulum and trochlea. So that's how I know I'm on the anterior side. On your reading right, I have a posterior view, and I know that because the elbow looks distinctly different from this view. Also note on both diagrams that your lateral or radial side of the forearm is the more exterior on both of these views. So let's start with our reading left, which is the anterior or A to P view of the forearm. Along the outside or left side in the case of this diagram, we have the radius. All the way at the superior or proximal end of the radius, we have the head of the radius and the neck of the radius. The head of the radius always has a distinct shape to it, and I remember that shape because it reminds me of a radial tire. So we have the head of the radius, the neck of the radius. Also at the proximal end in purple, we have a large tuberosity, which will simply be called radial tuberosity. Then at the distal end of the radius, in red, we'll have the styloid process. When you think of the term styloid, it makes you think of a pen tip, which means it's going to be a sharp projection. Now, we also had a styloid process on the temporal bone up in our skull. So if you remember the way that styloid process looks, that's going to give you a clue that the styloid process of the radia will also be a similar looking projection. This is one of those examples of why it's so important to label the bone that you're on, because if you say styloid process as your lab identification, there's actually 3 bones that have a styloid process: the temporal bone, the radius, and the ulna. So going right next to the styloid process of the radius in red, take a look at the styloid process of the ulna in light blue. You can see it from both the anterior and posterior views. And again, this looks exactly the same. It's kind of like a pen tip, a sharp, pointy projection. So the styloid process of the ulna is in blue. Now, interestingly enough, we're at the distal end of the ulna, but this is actually the head of the ulna. So the head of the radius was on the proximal end, and the ulna will be the exact opposite. So the styloid process of the ulna in pale blue is on the head of the ulna in dark red. Going back up, the radius and ulna will both have a body or a shaft of the long bone. And in between radius and ulna, these are connected in the forearm by a structure called the interosseous membrane. And that word interosseous literally means membrane between 2 bones. Going over to the reading right diagram, which is a P to A view of the forearm, you notice how that posterior elbow looks distinctly different, no bow tie structure. So if we look up at the proximal end, I can see my head of the radius in dark red, which looks like a little radial tire with its neck at the proximal end. The ulna at the proximal end has a very large structure called the olecranon, which, if you recall, the word olecranon literally means elbow. This is that pointy end of your elbow, like if you hit your elbow on the edge of a desk, that would be the olecranon. And the olecranon is a large structure which fits perfectly into the olecranon fossa, which is on the posterior side of the distal radius. So the olecranon fossa and the olecranon of the ulna fit perfectly into each other to help make that elbow joint space. Now I'd like to show you some views of the actual elbow as a joint connecting the humerus and the two bones of the forearm. So on your lower reading left, we're actually going to take a look at the ulna as a standalone bone. So the ulna and the radius, when you see them alone, they are going to look very similar. They're both thin, long bones. The way you're going to tell the difference between these two is the head of the radius is going to have that little radial tire shape. And the top of the ulna is going to have this large C-shaped notch in it. So on our reading lower left, we have a lateral view of the proximal end of the ulna. So we can see that large olecranon, which is a process that makes up the tip of our elbow. And then we see this large C-shaped notch. And that's called the trochlear notch. And it gets that name because it fits perfectly into the trochlea of that bow tie shape of the humerus. In your upper reading right, we're looking at a medial view of the elbow joint. So we're looking at the inside of our elbow. You can see the bow tie structure, which is the capitulum and trochlea of the humerus, perfectly fitting into the radius and the trochlear notch of the ulna to create this joint space. In the lower reading right diagram, we're looking at an inferior view of both the radius and the ulna. So what I'm showing you here is just like the view above, where these two bones fit perfectly into the humerus to make an elbow joint, the lower ends are also going to make a joint space. Our carpals are the names of the 8 bones of the wrist, and we're perfectly creating a joint space both at the wrist and at the elbow. So the bones of the forearm are going to transition distally into the carpal bones. And the carpals represent the 8 bones of our wrist. These are very small bones, but even though they're small, they'll still be connected to each other by ligaments because a ligament connects bone to bone. The carpals are arranged in 2 rows of 4 each. So we'll have a proximal row and a distal row. The proximal row is made up of bones called scaphoid, lunate, triquetrum, and pisiform. And the proximal row articulates with the distal radius and ulna. The distal row of the carpals is comprised of the trapezium, the trapezoid, the capitate, and the hamate. And the distal row of carpals will articulate with the metacarpals, which are the long bones of your hand. And I know what you're thinking. You're thinking, how am I supposed to remember these 8 bones in order? But don't worry, there's a mnemonic coming up for that. Distal to our carpal bones, we have the metacarpals, which are the very small, long bones of our hand, and we have 5 of them for each of our digits. So the 5 metacarpals will actually make up our palm and back of the hand, and they're going to be numbered 1 through 5. We always start on the thumb side. So the metacarpal that makes up the biggest part of your thumb would be called metacarpal 1, with the part of your palm and back of your hand that makes up your pinky being metacarpal 5. The actual bones of the finger, the part of your finger that you can move quite a bit, are called phalanges. And phalanges is the plural word. If you were speaking in singular, you would say phalanx with an X at the end. So the phalanges are actually the bones of your digits. We have 14 total. Fingers 2 through 5, with 5 being the pinky, have 3 each. We have a proximal, middle, and distal phalanx, but the thumb will only have 2, a proximal and a distal phalanx. Let's take a look at the bones of the hand. On your reading left, we have an anterior view of the carpals and hand. So we're looking at our anterior or palm side. On your reading right, we've got the posterior view where we're looking at the back of the hand. In both views, you can see the 8 carpal bones. Now, don't worry about looking at which bone is which quite yet. We'll do that on the next slide. But I do want you to notice that it does look like there's actually 2 rows. And I also want you to notice that they're all somewhat small and circular shape, but you can probably imagine that if you took them each apart, that they would all have their own distinct shape. And a lot of their names represent the shape. Like, for example, the carpal called lunate is moon-shaped. The scaphoid is named for its shape. So is the trapezium and the trapezoid. Just distal to the 8 bones of the carpals with the purple highlighter, we have our 5 metacarpals, with the thumb being called metacarpal 1, pinky metacarpal 5. And of course, when you're labeling these in a lab situation, you would always want to label which hand you're on. Just distal to the purple highlighting in the large blue section on your reading right, we have the phalanges, phalanges being plural, phalanx being singular. We have 14 total phalanges on our 5 digits. Digit 1, which is the thumb, only has a proximal and distal phalanx. Digits 2 through 5, with 5 being the pinky, have a proximal, middle, and distal phalanx. Each of these phalanges is actually a little long bone in itself. So even though they're tiny, their bone shape classification is still a long bone. So that means that each of the 14 phalanx will have a base, a shaft, and a head to them. So take a look at your reading left, which is the anterior or palm